I mean, it has become increasingly clear that New York City is the epicenter of this outbreak nationwide, and President Trump has signed a number of major disaster declarations for a number of states, including right here in New York, but not for neighboring New Jersey. Despite them having the second highest number of cases, it has led to many people wondering why. President Trump has now declared a major disaster declaration in 5 states, including New York, but not New Jersey, despite it having the second most cases in the nation. He has already accepted disaster declarations from states like Texas, Louisiana, Iowa, and Florida, as he remains defiant on reopening parts of the country by Easter, despite the advice from medical professionals on his own staff.
There are large sections of our country probably can go back much sooner than other sections, and we're obviously looking at that also.
Mayor Bill de Blasio telling New Yorkers that April will be worse than March and that even May could be worse than April.
The notion that everything might be fine by Easter, I don't know where on earth that idea comes from. We should not cling to that false hope.
Meanwhile, Governor Cuomo says even as the pandemic grows, there are now concrete signs that social distancing is slowing the spread of the coronavirus.
The evidence suggests that the density control measures may be working.
This past Sunday, the projection was the cases were doubling every 2 days. That's a rate higher than Italy. By Tuesday, it was nearly every 5 days. This as more and more first responders are getting diagnosed with the virus, including 34-year-old EMT Crystal Cadet, fighting for her life inside the ICU in critical condition.
We always remind her you have to take care of yourself before you be out there. But unfortunately, at the end, this is what happened.
This as the FDNY is now asking New Yorkers to stop calling 911 unless it is a life-threatening emergency. They tell us, a spokesperson tells us, that they are now receiving calls of New Yorkers asking healthcare questions, asking questions about testing that is not for 911, only emergencies if you're going to use that service.